This is how I wake up most mornings. That my head and my neck and my back hurt so much that just even getting out of the bed is a feat.
Migraine is a kind of a headache that typically affects just one side of the head at a time. It can be accompanied by nausea or disturbed vision. About 1 billion people worldwide are affected by migraine. Attacks can last an hour or it can last the whole day or days. The pain can really vary, but can be extremely severe and take you out of your daily activities. There are many potential triggers for migraine. My trigger for migraine is my neck. I have retrolisthesis in my neck at multiple different levels from an injury that I sustained from a car accident back in 2022. But there are many things that can trigger migraine. You would need to keep a diary to see if you can develop a pattern to figure out what your migraine triggers might be. When a migraine does come on, there are multiple different treatments available. Some are over the counter and some are by prescription. For me, my cure-all tends to be the rizatriptan. It usually works for me within 30 to 40 minutes, which is a little bit slow, but not too bad. I've also dabbled in multiple other types of prescription medications that are specific to acute migraine to see if they would help, and I haven't really found anything that really matches for me quite as well. There are lots of other options such as ice or topical essential oils. One of my patients very kindly made a little roller ball for me that I really like that has frankincense, myrrh, lavender, lemongrass, and marjoram in it. And I rub it on my head, like my temple area where my head is hurting. And that does make a big difference. She mixes it into coconut oil and put it in a little roller ball. It works pretty well. And then I can use the triptan, of course, if any topical treatments or eating something or staying hydrated or having a little caffeine, if none of those things are really working. Tylenol and ibuprofen tend to be helpful. For me, like this particular morning when I woke up, my neck and my back were so incredibly flared and painful that I did end up taking the ibuprofen and the Tylenol in addition to the rizatriptan. Whereas if it's just the migraine that's happening, which typically is involving my neck as well because I do have that neck issue, I will take just the Maxalt and I can lay down, which is the rizatriptan, that's the name brand, and then I can lay down and just wait for it to kick in. It's always the worst when I wake up on a work day and I have to get out of bed like that and push through. It's really, really awful, but I know what works. So I just keep telling myself that if you just get up, you just stretch out, you take your medication, you do your shower, you get ready, things are going to get better, and they usually do. There are so many different preventative options that are out there on the market. Some are prescription, many of them are, and I have had varying success with many of these different items. The prescription preventative migraine medications, specifically known as the CGRPs, are newer, and I have had some success with those. But for me, for some reason, they wear off after a little while, and I have to take a break from them and then restart again to have any success. And then if I do get in a pattern where I have a migraine every day for like 30 days, which is awful when it happens, but it does, once in a while I have to do a little bit of prednisone, either a little taper or maybe like 4 days, just to break that migraine cycle. And that has worked for me a couple of times, especially when my neck and my back are really bad and really flaring. Exercise, stretches. I have had injections in my neck and in my back as well. Some really tight spasm areas that just wouldn't let go, that I did have some treatment on those, and that was extremely helpful. Osteopathic manipulation. I am an osteopathic provider, so I do use osteopathic manipulation as part of my practice, and I do a lot of chronic pain management. I fell into chronic pain management because I fell into addiction medicine when I started doing my practice 20 years ago. I should also add, and I think it was on the last slide, that opioids are definitely not a preferred treatment, either long-term or short-term, for any kind of chronic pain, including migraine, acute or chronic, because opioids end up developing this pattern that they can actually make a rebound headache happen. So they end up making the situation worse. Or when people end up taking them for long periods of time, like say for issues with like their neck or their back or something like that, they can actually become addicted to them. And then using them for a long period of time can actually make pain worse. It's called opioid-induced hyperalgesia, which is a really common condition that now doctors are really becoming aware of and patients are really becoming aware of. So we're working really hard to taper people off of opioids and to use less and less of them, and to really reserve them for those real emergency situations when they're really appropriate. If you're having a lot of migraines, it's definitely worth having a conversation with your provider about these preventative treatment options. And if your provider isn't familiar with them, they could refer you to someone who is.